Wendy Larkin, thank you so much for joining us here at the Breast Cancer Wellness Summit. I am really excited to talk to you and learn more about how you support breast cancer survivors as a certified medical exercise specialist.
Thanks for having me.
Wendy Larkin, thank you so much for joining us here at the Breast Cancer Wellness Summit. What did I say before? Okay. Wendy Larkin, thank you so much for joining us here at the Breast Cancer Wellness Summit. As an advanced medical exercise specialist, you support breast cancer survivors in their recovery with their mobility, with their nutrition. I mean, your approach really is a holistic approach to
Right.
getting people, I'm going to say, as a certified advanced medical exercise specialist, how do you approach designing exercise programs for breast cancer survivors as they're recovering?
So it's such a multifaceted approach, well, at least the way that I do it, because I have to take a look at the whole individual, as you were talking about holistic care. So I have to take a look at where they are in their stage of recovery, if they're still in treatments, if they're post-treatment. I have to take a look at type of surgical procedures that were done and how some of those procedures could affect their mobility or their strength. I have to take a look at the type of medications that they take, which
Mhm.
also affects the body. For example, if I'm on an aromatase inhibitor, and so I've been put into chemical menopause, I have to take that into consideration because how their connective tissue is going to respond to exercise, because estrogen is, responsible for collagen production.
Mhm.
So, and then I have to take a look at whether or not they've had cording, what type of scarring they've had. Again, I said reconstruction surgeries. So if they've had a DIEP flap, or
Mhm.
if they've had lymph nodes removed. So it is such a multifaceted the way that I have to take a look at that, because I also have to take a look at the individual
Yes.
and how they mentally went through treatment, because there's a huge difference. Some people, they're just focused. This is what I'm going to do. This is how I'm going to get through, and I'm going to do everything that I have to. And then other people who maybe take a gentler approach, we'll call it that way.
So, you just identified two different mindsets. And I think in our aside, before we started talking live here, we had talked about, the different mindsets and how, it really requires a skill set on your part to be able to work with different ranges of people with
Yes.
certain mindsets. And how do you navigate that, because there is a lot of, I'm going to say,
Personalities.
yes, yes.
I have to meet people where they're at. I really do. And the more I can approach a lot of this, because everything is very clinical, right? Especially if
Yes.
you've done physical therapy, everything is
Mm.
very clinical. So I kind of try to remove some of the clinical aspects of what I'm doing. It's still clinical, but if
Mhm.
we can make jokes along the way or have open, honest conversations without fear. And if they want to break down and cry, they can break down. I've broken down and cried with many people over the years. I've also taken out the Palo Santo wood and the sage, and I've cleaned auras. So
Yeah.
whatever makes people feel good,
Mhm.
might be the boxing gloves or
Yeah.
the kick pad,
Yeah.
the slamming of the balls. So just kind of, once I can recognize what headspace they're in, then I can kind of mold things accordingly. And I mean, I'm just a goofball, so I think that helps a lot too.
It helps that you're versatile. it helps that you have the skill set to be that versatile and be able to accommodate and work with those varying personalities. I mean, that
Right.
is extraordinary. That's remarkable. I mean, because I've worked with trainers, and sometimes people have that type A, go for it, and they're only going to be able to work with certain mindsets
Right.
and not be able to support and move people the way that you're able to move people. So I just want to applaud that and
Thank you.
highlight that. Yes. You know, it's really interesting to think about the different, I'm going to say, disciplines that attempt to work with cancer patients. Okay. You have a certification through the Cancer Exercise Training Institute, and that certification hones in on the education around being able to really address the specific needs of cancer patients. Wendy,
Right.
can you just talk a little bit about that training? And yeah, what I want to do here is markedly distinguish your skill set from someone who is possibly a personal trainer, but is not able to address the specific needs that survivors need.
Sure. The Cancer Exercise Training Institute is the course is really goes through, and it's not just breast cancer; it's all different kinds of cancers, but specifically all the different kinds of cancers, the treatments that go with those cancers, the side effects with all of those treatments, the type of surgical procedures that go with all of those types of cancers, the survival rates. So it kind of really creates a picture for that
Mhm,
individual and what they're dealing with. And then when you take in the medical exercise piece of that, so if I understand what a deep flap is, what a lat flap, what a lumpectomy is, or what a mastectomy does, once I that's what the Cancer Exercise Training Institute kind of taught me, like what those things are. But it's the medical exercise training that I've done that allows me to go, okay, these are the muscle groups affected, these are the type. I can kind of take it beyond a personal trainer's perspective and
mhm,
really look at it more on the medical side of, again, if I've had my breast removed, what are the implications of physically the rounded shoulders? What muscles are being affected because of I've had a mastectomy? Where a regular personal trainer might take a look at it and say, okay, well, you no longer have breast tissue, but you're good to go.
mhm,
And not
mhm,
understand that I've had people who have had full mastectomies who can't get their back muscles to fire because their chest wall is just so tight from scar
mhm,
tissue.
mhm, mhm,
So there
mhm.
are actual steps that you have to go through just to get a muscle to fire.
Right.
So it gets kind of down. When I say into the nitty gritty, it really does get into the nitty gritty. You have to understand all those things to provide a whole other level of service to people who are trying to feel better. And now they've started to develop maybe neck pain and shoulder pain, or
Mhm.
even abdominal wall pain if they've had deep flap or back pain, all those things. So it's so multifaceted, at least what I do,
Yes.
to be able to take a look at all of those things and make a complete uh, wellness program for them.
It is very convoluted, very
It's very
complex,
convoluted.
very complicated, particularly if you are really tapped in to getting the best results for your clients, which I am definitely getting that the impression that that is your perspective and your approach in working with your clients. So thank you for sharing that. It's really, I think, and let me just share a little bit here, Wendy, because when you talk about the different side effects, honestly, I did not go through any physical therapy. I did not have someone with your expertise and knowledge work with me. it was swim or sink, right? Like
Right.
that
See,
was,
now, if you were with me, I would take a look at, okay, this is the surgical procedures you do, here's the medications you're on, and you're a professional athlete for
mm,
basketball. Okay, what kind of um, things that you need to work on, whether it's endurance, if it's lateral movement, in addition to being able to shoot the ball. You
mhm.
know, so outside of this range of motion, I have to also take a look at all those things that you want to do. And so for
Yeah,
you, it was more because it was your profession. Where for
right.
someone else, it may be, I love playing tennis and I can't play tennis.
Hmm.
Okay,
Hmm.
tennis is our goal. So I have to, to speckle in some of the things that people need to do, want to do, love to do, really kind of gives the person in front of me also that I'm going to be able to do that again. I can do this again.
Yes.
That hopeful moment,
Hmm. Hmm.
picking up the kids.
Yeah, yeah. It definitely would have been helpful to have some outside energy to pull. Now let me just say this: my teammates, my organization, my family, like they were great, right? But to have someone on the outside that actually understood the nuances of what I was going through, not just, oh, Edna wants to grow her hair back, she wants to be healthy, she wants to get back to her professional basketball career, right? Like it's a whole other level of healing that
Yep.
I'm being exposed to with you. So again, I'm thanking you. And if you're a survivor out there and you're going through it, I'm hoping that you're tuning in and do not leave this interview until we're done. Because here's the thing, Wendy, do you receive patients or clients that have not had physical therapy?
Yes,
Mhm. And are those some of the hardest patients to work with? Like, because I'm going to
it
assume that
is.
they haven't had like the foundation of their mobility dealt with. So by the time they come to you, they've probably gotten more bound up, more limited, more apprehensive about their ability to move.
Yes. So um, I have two people in particular that I can speak of who didn't didn't do the work. We'll just say didn't do the work. Now,
Mhm.
physical therapy is offered, and you can talk to your oncologist, and
Mhm.
most oncologists will 100% send you to physical therapy. That's
Mhm.
without question.
Mhm.
So it is the matter of you being able to express that to your physician. But for the people, these two people who came to me, um, I don't know that it was that they didn't ask for it, or is more of the like they were so done with doctors and hospitals that they, because they went through some pretty tough times, that they just
Yeah.
wanted to step away from it and
Mhm.
almost, you know, get to that point where I don't want to think about cancer anymore. I've been through it. I'm done with it. But one was a double mastectomy. And when
Mhm.
I tell you, it took me at least a month to get her chest wall to open up just so she can get to this position. And then from
Mhm.
there, trying to get the back muscles to fire again and get her out of that forward roll position. She was
Mhm.
dealing with the neck pain and the shoulder
Mhm.
pain and the weakness. And it took a good month just to get the muscles to remember what they were supposed to do. And then
Mhm.
with radiation, because of radiation causing, atrophy of the muscles, and, lymph node removal can cause numbness and tingling. So those, you can't even feel those muscles for a
Right.
long time. And
Yep.
the longer you push that off, the harder it is to bring it back. I'll
Mhm.
do everything I can, but it takes a much longer time. The other person had um, a unilateral mastectomy, had expanders put in for reconstruction, developed an infection, which led to sepsis, which put her back into the hospital. So she
Mhm.
wound up opting for a DIEP flap.
Mhm.
Okay, DIEP flap. I have a breast created from natural tissue from my abdominal wall. This is great. I'm not going to get infections. I'm healing from that, but not understanding what
Oh,
those further down the road things. So you've cut into your abdominal wall, you've taken fat tissue, you've taken skin, you've taken
Mm.
nerves, you're taking veins to create a
Wow.
breast.
Wow.
And she was having back pain. So she came to me because of back pain.
Mm-hmm.
And she was convinced that the cancer had spread to her spine. And I was like, well, you need to go get your MRI,
Mm-hmm.
100%.
Mm-hmm.
But one hip is here and the other hip is here, and they're kind of rotated around this way.
Mm-hmm.
So let's just do a couple mobility things, see how you feel. She hadn't slept in 6 months because of it. The next day, she was like, first time I've slept in 6 months.
Right.
I was like, yeah, you're all
Mm-hmm.
wound up
Mm-hmm. Mm-hmm.
physically, mentally, emotionally.
Exactly. But I have been removed from my diagnosis for a number of years, and so many things have changed. Now, it's the patient's obligation to request physical therapy, or is that not standard? Is that not a standard course
I
of
don't know
action?
that it's standard per se. You may post surgery get some physical therapy to make sure that you're moving in a range of motion again,
Hmm?
and then you're given a bunch of exercises to do, but it's not like a long-term continued therapy. And again, everybody's health insurance is different. We all know how health insurance is,
Hmm. Wow. Yeah,
and it
that
should
was,
be universal, right? Everybody
yes.
should get so many times with a physical therapist, so much
Mm-hmm.
with a lymphatic drainage person, so much time with a nutritionist, and they all have access to it. But whether they use it, apply it, follow through with it, and
Right.
continue to request it is
Hmm.
something else.
Now, as you are putting together exercise regimens, y- what is your process for making sure that what you're doing is also in alignment with maybe what they've done in PT, like a continuation of
Sure.
their progression? How do you work in collaboration with, let's say, a physical therapist or even the patient's physicians, right? Understanding the medications that they're on, just really understanding everything that's going on with the person that walks through your doors.
Right. Connection with the oncologist, I feel, is a little bit more difficult
Hmm.
because of their plate, how many patients they have on their plate. I make sure that all the oncologists have my information,
Hmm.
so they can, my clients are meeting with their oncologist, the oncologist also has an opportunity to either, based on what they see, what they've heard, reach out to me, or to reach out to an oncologist is still, most of them, everything is through a portal now, so
Hmm.
it's very difficult. Physical therapists are a little bit easier because I can have the person who comes to me say, I want to speak to your physical therapist, have them just send me an email. And then so we can have quick email communication. Or if you have a list of the exercises that you've been doing, bring those in so I can take a look at where they were going with those exercises, and then continue to work those in and then progress off of those.
I think that is an incredible collaborative effort, because if it were left up to most of your clients and patients to make sure those dots were connected, you would more than likely have some gaps. And maybe those gaps are just misunderstandings or lack of understanding. But I think that kind of streamlines your ability to effectively create exercise regimens and design programs for your clients.
Right. And I have no qualms with saying this is what I'm thinking, the direction we're supposed to be going. If they have a physical therapist they're currently working with, I
Hmm.
want you to check with them first. Send them a message on the portal. Here, I'm going to write it out for you. Send them this question. And if they say, yep, that sounds good, then I can continue on with it. Again, sometimes because I feel like oncology physical therapy, oncology nutrition is such a unique niche that there's not as many of them as needed. So they're going from patient to patient all day long. So sometimes there can be a breakdown in the communication of how fast I get the information. But what's
Hmm.
great is I've surrounded myself with people in the know.
Yeah.
So, for example, Dr. Mike from
Hmm.
the
Hmm.
Medical Exercise Training Institute,
Yep.
I will call him all the time and say, here's the situation. This is what I'm thinking. And he will talk me through. And I've done that for many different kinds of situations. And, given him the background and said, this is what I'm thinking is the pathway I should follow. And he'll either say yes, or he'll say, don't forget to think about this. And then make sure
Hmm.
you check that. And
Yeah.
then he follows up with me too. So I have so many people. I've surrounded myself with people who are much smarter than I am to make
Hmm.
sure that I have someone to always check back to.
That's brilliant. You,
You,
so
you got to let go of
you
the ego. Too many trainers
exactly.
have this ego of like, I
Hmm.
know what I'm doing.
Yeah.
And sometimes you just go, no, 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 you don't.
So Wendy, as you're kind of like on the cusp of conventional medicine, right? So how how do most of the physicians and physical therapists, how do they view your work? And have you found that they are supportive, they are collaborative, and that they are, you know, willing to work with you alongside their patients?
Oh, yeah, I've been super fortunate. And I think because what I do, again, is so unique with
Hmm.
my education and background. Um, if someone goes to their physician and they say, oh, I've been working with Wendy Larkin, many, many times their doctors would be like, I know her. I've heard of her. I have other patients who use her. Because a lot of them, there's probably 3 to 4 max
Hmm.
oncologists of
Yeah.
all the people that I've worked with that
Hmm.
all that's their oncologist. So their oncologists hear my name all day long,
Right.
which is good
Yes.
because they'll also say, okay, the next time you see her, tell her this, or I've got
Mhm.
some other people that I'm referring to her. Here are their names. So
That's great. You know, I'm coming over to see you, Wendy. No, not, here's the thing. It's like I can do everything I want to do in my life, but I will tell you this. I have this nagging tension under my right scapula, okay? Like it comes and goes. Like I don't I don't play basketball but I hike, I do my cardio, and every now and then, I might lift weights, right? But once this scapula gets all bound up, it is like, it's almost like it gets attacked, okay? And I'm like, what just happened to this thing? So, as you were talking about some of your patients and some of the side effects. I'm going to venture to guess that I have some ongoing trigger or when I go through certain motions and it just locks my scapula up.
right.
And it's it is the
So
most
if I was to evaluate you
hmm.
through this screen, I
Hmm.
can tell you that your right shoulder is higher than your left. I can assume that you're,
This
yeah,
one, this one.
uh
Okay, is it
huh.
because okay, now I'm gonna take my arm off the armrest. Hmm.
Okay.
Yeah.
It's still higher. Your right
Okay.
trap looks, your neck is also rotated. Your head is slightly rotated to the right. I can
Hmm.
tell that your pec is tighter on that side. Now, this
Hmm.
is through a screen.
Oh no,
But
no.
now
You are
I'm going to say scar tissue, and then I'm going to
hmm.
evaluate your lat and your serratus, and
Yes.
then the strength of your rhomboids, and then I can take a look at your shoulder and say, because that would have been your power arm,
Yes.
that how what is the mobility in the joint of the shoulder? Do you have
Mhm.
excessive mobility from constantly doing that? I'd also take a look at, have you torn your rotator cuff at all in the
Yeah.
past?
Hmm.
have you,
Hmm.
what kind of injuries you've done. But
Yeah.
I could see right now, and I'd probably start with some mobility and foam rolling and maybe some trigger point,
Yep.
and then take it from there.
Thank you. Because
Through the
Wendy for
screen.
the win. No, and honestly, I think I've recognized those things, right? But it's like I put that lacrosse ball here and I get it here and it's work, Wendy. Oof.
It's a lot of work.
Yeah, but thank you
So
for
that's
sharing that.
another thing that I do, though, is
Uh-huh.
because a
Uh-huh.
lot of people are like, this is way too much for me to do.
Yeah.
So I have to simplify it down. And I
Mm-hmm.
have to
Mm-hmm.
make it where, okay, every night before you go to bed, you're going to do snow angels, open books,
Yes.
and
Mm-hmm.
maybe just roll out your lats. And I'm going to give you three
Mm-hmm.
things to do, and it should take you 15 minutes to do. And that's the only thing that I want you to focus on. It's all, you got to meet people where they're at. And when
Yes.
people have been overwhelmed because of treatments and they've been
Mm-hmm.
overwhelmed with, a lot of my clientele, they were pregnant when they were diagnosed.
Mm-hmm.
So they had to do chemo during pregnancy, give birth, maybe nurse their child for a week if they were lucky, and then go right in for surgery and then start chemo. And so everything for them is just like, it's a lot, because now that I at least I've made it to the other side. I want to focus on my children and my husband and the house and trying to get back to work and fixing my career. And they've forgotten that they still need to take care of themselves.
Excellent point, Wendy. And I believe that it is just ongoing. It is ongoing.
It's ongoing.
Um, and I think that's where people, even myself, you just you get tired of doing it. Because you have to stay on it. Like you're saying, it becomes a daily regimen.
Yeah.
And I'm not saying that I don't move and I don't stretch daily, but do I go into the space of feeling the pain?
Exactly. Some people
Yeah.
don't like pain.
Well, I will do it, but I may only do it twice a week. Okay.
Right.
Not, and I think that what you're saying, and I'm echoing this because it's important for survivors to hear this, that this requires ongoing attention and management to your body and your health as you recover. So thank you for
Scar tissue doesn't go away.
to a deeper level, reflecting on your expertise and how you have supported breast cancer survivors over the course of your career. What advice would you give someone who has been hesitant or I'm going to say negligent about deciding to move, deciding to uh, work with someone in order to regain their mobility and to improve their quality of life?
Right. Um, Best advice I could give is, even just starting off slow with
Mm.
something light on your own. And then when you're ready to take this to the next level, whether it's with someone like myself or a personal trainer or going to some group fitness studio or starting
Mhm.
Pilates, you know, really talk to, and people get scared to talk to instructors, and don't be afraid. I mean, this is how you know the type of person that you're putting your life in their hands, right? So talk to them, tell them what you've been through, let them, take a look at what they think would work best for you. And, use your instincts. Some people, I've had, someone who has rheumatoid arthritis. She's 29 when she was diagnosed. And she went to a trainer who told her, absolutely, yes, I know what to do. And what he did with her, I didn't even want to, it was negligent. It was completely
Mhm.
negligent. So people will tell
Mhm.
you, yes, I know what to do with you. Don't be afraid to say, what exercises do you feel would be best for someone who's been through what I've been through?
Mhm.
And if they don't give you a good answer, move on. The cancer exercise trainings, Institute, I keep on saying studio, Cancer Exercise Training Institute does have a section on their website where you can search for a certified individual in your area. So you can find someone that that at least has an understanding of what you've been through, at least
Mhm.
especially in the basics, right?
Right.
And I think the Medical Exercise Training Institute also has people who are trained like I am in medical exercise, which is pretty much, I'm not a physical therapist, but I am the person who the physical therapist should be sending their patients to continue on with therapy. So I can't do all of their modalities, but as far as exercise is involved, I'm trained in the same exercise therapies that they do. Um, and join support groups and talk to other people in the support groups because they've got their list. If you were to go into uh, it's called BAYS, Bay Area Young Survivor Network,
Okay.
and ask someone for any recommendations, I mean, 200 people will pop up with my name because 200 people plus have worked with me. So they've had that experience and it's been a positive experience. So they will recommend me, but someone may also have worked with someone else that's maybe closer to where you live. So they can recommend that person. So connect with other people who've been through this and are on the other side, who know the good people.
Thank you so much for that direction, that insight, and that guidance. Wendy, if the viewers and listeners wanted to find you, connect with you, how would they find you?
They could go to wendylarkinpt.com, wendylarkinpersonaltraining.com. And, or I'm also on MindBody, if anyone uses MindBody app.
Mhm.
I'm on there. But so the phone number's on there. You can leave me a message on my website. That's usually the easiest way. I am one of those, OCD. I pretty much respond right away kind of
Mhm.
people. And if I don't think I'm the right fit for what you're going through, or I've had people who want to start training and you're got another month of radiation. Finish out the radiation. It's not worth starting now.
Mhm.
So I will tell you yes or no as far as I'm concerned. If when I think you should be ready to come see me. And if not, I'll kind of guide you along for things that you can do, until you're ready to see me.
Mhm. Thank you so much, Wendy. It has been a pleasure. It has been rewarding to know and to listen to you share the information that you've shared with the viewers and listeners. But also, it's been extra rewarding for me to take this in on a personal level. So
Yeah,
thank
thank
you.
you. Now you know you need to foam roll.